Hello everyone, this is Dr. Tania. I'm an obstetrician dealing with high-risk pregnancy cases. So today I'll be talking about the interpretation of TORCH results in pregnancy. So when I talk about TORCH, I mean IgG and IgM. So first of all, let us see that why TORCH, IgG and IgM is prescribed in pregnancy. It's basically prescribed in three situations. One is when the patient had a contact with a person infected with any of these infections. Second is when all of a sudden you see that the patient has developed fever, rash, arthralgia, lymphadenopathy and other flu-like symptoms. Third scenario is when on an ultrasound you see that fetal anomalies are there. So these are the three scenarios, the broad three categories when we go for TORCH, IgG, IgM. Now how do you interpret the results? First scenario is when you see that on the report IgG and IgM both are negative. So the moment you see IgM is negative, please do not get happy. That IgM negative being negative doesn't always mean that it is negative. Sometimes what happens is we do the test very early in the course of disease. So in that case, IgM might come negative. So in this scenario, please repeat the test 4 weeks after the contact or 7 to 10 days after the onset of symptoms, especially rash. The second scenario is wherein you see that IgG is positive and IgM is negative. Now again, when we see that IgG is positive, this means that either prior infection was there or prior immunization, especially in the case of rubella. So again, you see that IgM is negative, you get happy. No, please do not get happy. Again, I'll repeat, if the clinical suspicion is high, so please repeat the test 4 weeks after the contact or 7 to 10 days after the development of symptoms. Now the third scenario is wherein IgG and IgM both are positive. Now this is, this is acute infection. Now this acute infection might be a primary acute infection or might be a reinfection. So when both are positive, please go for IgG avidity test. Now IgG avidity will tell us, when the infection has actually occurred. If the IgG avidity is high, that means that the infection has occurred 4 months back. And if the avidity is low, that means the infection has occurred within the past 3 to 4 months. So just look for that. The fourth scenario is when IgM is positive and IgG is negative. Now again, when IgM is positive, so please do not worry. IgM, you have to first understand that IgM may remain positive for months or years after the acute infection. So when you see IgM being positive and IgG negative, so in this case, repeat IgG 2 to 3 weeks later. Seroconversion should be there. That means IgG should turn positive if it is an acute infection. If the IgG has not turned positive, that means that the initial IgM which was positive is a false positive result. So IgM false positive can be associated with rheumatoid factor, anti-nuclear antibodies, or in other scenarios. So how to see that IgM is a false positive result or IgM positive is a true positive result? So in that case, you can go for IgM capture ELISA or IgM immunosorbent agglutination assay. So these are the tests which will tell us that whether it is a true positive IgM or a false positive IgM. So what is the take-home message? One is that IgG avidity is done only when IgM and IgG both are positive. Second thing is that IgM, when it is positive, please do not worry. And when it is negative, please do not relax. IgM can be positive for months or years after infection. And IgM, if it is negative, doesn't mean that the infection is not there. If the clinical suspicion is high, you have to repeat the test. So this is all. Thank you.